Good evening, everyone, and happy Thanksgiving. This is Nurse Eunice with Florida Training Academy, and today we are going to be reviewing another 100 CNA practice questions. And as we do in every video, we're going to give you a few moments to receive your notifications, and we will get started shortly. And good evening, Mimi. You're the first one who has commented. And everyone, I hope you have had a wonderful Thanksgiving holiday full of family, friends, and love. All right, so let us begin. If you're unaware, we do have our CNA exam prep workbook and our Black Friday sale. The book is only $9.99. So if you need assistance with passing the Certified Nursing Assistant examination, just go to our website, fltraining.com, and then click on the tab that says CNA exam prep workbook, and you'll be directed to our shop where you can purchase our workbook. And thank you in advance for supporting a small nurse owned business. All right, so let's begin, team. Question number one. Many elderly residents lose their appetite due to A, a decrease in saliva, B, hardening of the arteries, C, decrease in the number of taste buds, or D, both A and C. And I see so many of our faithful viewers tuning in. So, good evening and happy Thanksgiving, everyone. And let's see, we'll reveal the answer in three, two, and we have a lot of D's. The D's have it. You are correct. So, the rationale. Elderly patients often lose their appetite due to physiological changes such as the decrease in saliva production and a reduction in the number of taste buds, both of which affect the perception of taste and interest in food. And don't forget about those different medications that they take that can also leave a metallic taste in their mouth. All right, so let's go to our next one. Question number two, and we're here for 100 questions, you all. So hopefully you can stay tuned for the entire video. If not, come back and check the rebroadcast. Question number two, the thinning of the fatty layer under the skin could cause the resident to, is it A, lose their appetite, B, have difficulty walking, C, develop pressure sores, or D, have slowed mental responses? And I see Linda and Susie. I see the correct answers coming through. Hi, Rose. Everybody in three, two, and one. When the fatty layer under the skin, when the adipose tissue thins, your patient's going to be more at risk of developing C, pressure sores. So, thinning of the fatty layer under the skin reduces the cushioning and increases susceptibility to pressure sores, particularly in areas where the bones are close to the surface. So, great job, team. Question three. Elderly residents sometimes appear stooped over and like they have lost height. This is due to A, loss of calcium causing changes in the spinal column, B, the deterioration, of muscle tissue, C, the resident's increased difficulty in breathing, or D, decreased cardiac output. Why do elderly residents appear stooped? And we'll reveal the answer in 5 seconds, team. So 4, 3, 2, and I see a lot. I see A's, I see B's, I see C's. So I see it is a little bit between A and B. And so remember, the skeletal system is what causes you to stand straight. So it wouldn't be the changes in the muscles per se, the spinal column, the skeletal system, because of the loss of calcium is what causes them to become stooped or bent over. So the correct response is A. And so osteoporosis and calcium loss in bones, particularly the vertebrae, can lead to compression fractures and curvature of the spine, resulting in the stooped posture and loss of height. All right, question number 4. One of the major reasons the elderly person is incontinent of urine is, and I hope you understand what incontinence means. Incontinence does not mean retention, it means that they are leaking, they are wetting themselves. So I'm going to reread this question. One of the major reasons that the elderly person's leak urine is A, they are too lazy to go to the bathroom. B, they can't get a nurse aide to help them to the bathroom. C, the circulatory system is failing. Or D, the muscle that keeps the urine in the bladder weakens. And I know this one's super easy, so I'm revealing the response in three, two, and Abigail K. Wong Acha. Ooh, I gotta pronounce your name. Adalunga. AJ for two, Priscilla. So many of you all, Ruth, Nikisha, Kelly. Happy Thanksgiving to you also. You are correct. It is D as in dog. Incontinence in the elderly is often caused by weakened sphincter muscles, which fail to keep the bladder closed rather than a lack of effort or nursing assistance. So I need you to get to the back, get them to the bathroom, quickly after they call. Otherwise, they may have an accident. It's not intentional. It's because their bladder, the muscles in the pelvic area are weak and they're going to leak urine. Question 5. Constipation and indigestion can result from A, slowed respirations, B, slowed mental response, C, slowed peristalsis, or D, slowed brain waves. Let's see. Let's see what you think the answer is. All right, I see a correct answer so far. I see two correct answers. Susie, Chrissy, Fayella, Abigail, close Abigail. I'm revealing the answer in three, two, and for two, you have it correct also. It is C, slow peristalsis. So the way I want you to think about peristalsis is the intestines as they are moving, as they are, pushing that processed food through the system. And then, of course, expulsion is when it ends up in the toilet as fecal matter. So peristalsis is the wave-like contractions of the intestines that move the food and waste. It slows down with age, leading to constipation and indigestion. It also slows down due to pain medications or your patients being in the bed too long, which is why we try to get them up and moving about. We give them food that has fiber, we give them fluids, but if you're giving food with fiber and fluids, but you just have them laying in the bed all day, they're still going to be constipated. So please get them up and walk them if possible. Question number 6. Strokes are seen in the elderly. Strokes are best described as A, when muscles die, B, when the brain is deprived of oxygen, C, when the heart fails, or D, when the lungs fill with fluid. What is a stroke? Yes, Mimi, Kelly, and Thea, Susie, you are correct. It is B. So a stroke occurs when the brain is deprived of oxygen. So blood flow to the part of the brain is obstructed, whether it was due to a blockage or aneurysm, and that leads to the oxygen deprivation and damage to the brain tissue, aka a stroke or cerebral vascular accident. Question 7. Which statement is true concerning sexuality in the elderly? A, sex and intimacy are not important. B, elderly women are not interested in sex. C, the elderly men and women are attracted to each other. Or D, elderly people are only interested in their health. This one may be kind of tricky. Let's see if you know the answer. And of course you do, so I can go straight to the answer. Great job. It is C. Hey, they still have interest in sex. So sexuality and intimacy remain important for many elderly individuals, and mutual attraction and emotional connection continue to exist in the later years. All right, let's go to question number 8. One of the major causes of depression in the elderly is it A, lack of money, B, going to nursing home activities, C, living with their children, or D, the inability to run their own lives? Why would an elderly person be depressed? Hey, I know we'd be depressed if we didn't have any money, but they're not talking about us. I'm talking about elderly people. So, what would be the correct response, team? Yes, K-Wog and Chrissy and Nikisha and Rose and Anna Kay and Abigail and so many of you all, it is D. They've lost their independence. So losing independence and control over personal decisions is a significant contributor to depression in the elderly. All right, question number 9. Which of the following statements about aging is true? A, most elderly people are confused. B, most older people live in nursing homes. C, most older people are alert and oriented. Or D, most older people are sick and helpless. Which is true? Oh, I'm over here doing my little happy nurse dance. Hey, if I wasn't so full off of turkey and enjoying time with family, I would actually show my face on camera, but I'll do that later, probably over the weekend. So you are aware that regardless of what you see on TV, that most older people are alert and oriented. So contrary to stereotypes, elderly people remain mentally alert and oriented. Although some may experience cognitive decline or confusion, that is not the case for most elderly people. Question number 10, you all. Question 10 of 100. When dry, hard stool fills the rectum and will not pass, it is called, is it A, edema, B, incontinence, C, atrophy, or D, impaction? And I am so proud of you all for studying with me. It just makes me so happy that you all just choose. You could be doing anything right now. You could be watching football. I think there's a football game on, but instead you're studying, and that just makes me feel so good. So I appreciate you. I applaud you, and I am revealing the answer in 3, 2, and so this one is tricky, everybody. It is D. I know you think it was constipation, but this is a worse type of constipation. So, impaction. Fecal impaction occurs when dry, hard stool accumulates in the rectum and cannot pass. So, we can't give the person a laxative. We can't give them a suppository because at this point it will not work. That stool is so hard, the nurse will have to glove up, loop those fingers up, and try to do a manual disimpaction. And if that doesn't work, this person would have to have the fecal matter surgically removed. So that is the difference between constipation and impaction. This is prolonged constipation where now nothing we're doing is getting the bowel or the fecal matter out of the colon. All right, so here we go, everybody. Question number 11. A sitting or semi setting position with the head of the bed elevated is called A, prone, B, supine, C, lateral, or D, Fowler's. Hmm. Brenda, Susie, Mirtha, Priscilla, you have it. It is D as in dog. It is Fowler's. The Fowler's position involves sitting or semi sitting with the head of the bed elevated, typically for feeding, improving breathing, or comfort. So, of course, there are two different Fowler's positions. There's semi, which is reclining, but then there's high. So, based on what the person is doing or how they are presenting, you will know whether they need to be reclining or all the way upright. Let's go to our next question, team. Question 12. Which of the following statements about nursing home admissions is false? A, most people prefer to put elderly patients in a long term care facility. B, some elderly people are unsafe at home. C, most families prefer to care for elderly relatives at home. Or D, family members may be unable to care for elderly relatives at home. And remember, for this one, you're trying to select the question or the response that is false. So, which is false? I think so far I have seen one correct response. And so the false one is not B because some elderly people are unsafe at home. The false one is not C because most family members prefer to take care of their relatives at home. So I'm going to show you all the correct response. It is A, this is false. Most people prefer to put elderly relatives in long term care facilities. No, they want to try to care for them at home. So, this is a false response. Many families prefer to care for their elderly relatives at home when possible. Though circumstances such as safety or caregiver capacity can necessitate admission to a care facility. Question number 13. Wasting or a decrease in the size of a muscle is called A, decubitus, B, atrophy, C, impaction, or D, edema. What what is the wasting of a muscle called, excuse me. And you all, I am home with my parents. They are spoiling me, but they are also loud. So if you hear my daddy in the background, he's a good old country boy from Georgia, and he's just loud. So just forgive him. And yes, everybody, you have it. It is B, atrophy. Remember, if you don't use it, you lose it. So, atrophy refers to the wasting or the reduction in the size of a muscle due to disuse or misuse or disease. So, sometimes with patients debilitated, they're not moving those muscles. We're going to say, hey, we want you to go in the room and do the passive range of motion exercises. We need you to help move those muscles for them. All right, so question 14. A confused resident tells you there is a monster in the closet. The nurse aide should A, pretend to kill the monster in the closet, B, tell the resident there are no such things as monsters, C, open the closet and show the resident nothing is there, or D, tell the resident you will take the monster home with you. Ooh, this one's kind of tricky, because we know what we tell our kids, but these are not our kids. These are patients. These are residents in a facility. They may be adults. So, what do you want to say? What do you want to do? And if you chose C, great job. Open up the closet and show them that nothing is there. So, reassuring a confused resident by addressing their concern, example, showing the closet is empty, can help to reduce fear without dismissing or ridiculing their perception. I know what you see in a facility. In a facility, you're going to be like, hey, they're going to say there's a spider on the wall. And you're like, I don't see a spider. And then when they keep saying there's a spider on the wall, you're just going to, grab for something imaginary on the wall and say, here, I got the spider and I'm taking it out. Don't do that. And don't do it on your test, because you're going to answer the question incorrectly. All right, so let's go to the next one. Question 15. All of the following are clues to aggressive behavior except A, clenched jaw, B, rocking, C, pacing, or D, depressed mood. So, which one is not a sign of aggressive behavior? Yes, Shanna K. Yes, Faye Ella, you have it. So, when you see your patient, let me go back. If they're clenching their jaws, if they're rocking back and forth, if they're pacing, they could be about to escalate. Okay, so that means that they could be about to make your day much more interesting, especially if you're on a psych unit. However, D, a depressed mood is usually not a sign of someone who is going to be escalating. So let me read the rationale. A depressed mood is not typically an indicator of aggressive behavior. Clenched jaws, pacing, and rocking are physical signs that may precede aggression. So I need for you to be safe caregivers. And if you see a patient who's exhibiting those signs and those symptoms, go ahead and notify your nurse so that you and your team can be prepared to try to de escalate, to calm this person down. Question 16. The primary reason for combative behavior in a resident is A, anger and fear, B, confusion, C, the resident is evil, or D, stubbornness. And I'm going to be honest, sometimes we do feel like those people are, not angels. I won't call them evil. But the correct response for this, I'll show you in 3 seconds. So 3, 2, and It is anger and fear, especially with the elderly. They're in your facility. This isn't their home. They don't know you. And you're like, why are you being so mean to me? Why are you trying to hit me? Because they are afraid and they are angry. So, combative behavior in residents is often a result of feelings of anger or fear, sometimes stemming from confusion or frustration. 17. Hospice specializes in the care of persons who are A, on Medicare, B, chronically ill, C, on Medicaid, or D, terminally ill. What do you think? Hey, Dorvillier. Brenda and Susie, you have it. Hospice specializes in the care of persons who are terminally ill. And the philosophy is that they provide comfort and support. It's not that we're leaving them alone to die. It's not that we're not giving them medical treatment. It's just that we are going to allow them to get pain medications, to enjoy life, to have more visitors in their final days. And sometimes it can be weeks or months. So it's more of a philosophy versus you just leaving someone in isolation and closing the door so they can die alone. We're going to focus on their comfort and their emotional support. 18. Which of the following is a proper way to correct an error in charting? Is it A, scribble it out with several lines, B, erase it completely, C, use correction fluid, or D, draw a single line through it? How do we correct an error in the chart? I know most of you all don't even use paper charts anymore. I'm dating myself. But in case you did make an error on a paper record, you would want to do, you all have it. It is D, draw a single line through it. And don't forget to initial next to that line. So errors in charting should be corrected by drawing a single line through the mistake, making the correction legible, and initialing it to maintain an accurate and traceable record. Remember, we have to see what you put down initially. If you just scribble it out or you put white out on top of it, it's going to appear as if you were trying to hide something. And we want to see what your original entry was in addition to the correct entry that you'll put next to it. 19. Headaches, nausea, and pain would be called A, symptoms, B, observations, C, charting, or D, recording. Headaches, nausea, and pain. These are things that you would not necessarily see, but that your patient would report. So, what would be the correct response? I see a lot of A's. Let's see if you have it. In 5, 4, 3, 2, you all have it right. Great job, team. It is symptoms. So, headaches, nausea, and pain are subjective experiences reported by the resident and are classified as symptoms. Observations will be something that you see, such as the color of the urine was amber. That would be something that you saw, something that you could report versus what the patient reports. Question 20. The nurse aide is giving care to Mr. Tom. Mr. Tom calls the nurse aide by the name of his son who died several years ago. The nurse aide's best response is to A, quickly finish the care and leave Mr. Tom alone. B, pretend to be Mr. Tom's son. C, ignore Mr. Tom because he is confused. D, ask Mr. Tom about his favorite memories of his son. Which one seems more compassionate? Which one has more empathy? Yes, it is going to be D, you all. Ask him about his favorite memories. Mr. Tom, I'm not your son, but you just seem so fond of him. What do you remember about him? So, engaging a resident in a discussion about positive memories can provide comfort and validation, fostering emotional connection and reassurance. Remember, with communication, especially as a caregiver, it's not always about you talking. You listen, nod appropriately, and then every now and then ask an engaging question. Question 21. Who supervises the work of the nursing assistant? And I expect everyone to get this right. So is it A, the nurse, or is it A, the nurse, or is it A, the nurse? Yes, everybody. The nurse supervises the work of the CNA. So, nursing aides work under direct supervision of a licensed nurse. And yes, you have different levels of nurses, but for your test, it's either going to be charge nurse or registered nurse, usually for your CNA examinations. The nurse oversees your task and provides direction regarding patient care. Question 22. Various factors will change the pulse rate. Increased pulse rates can be caused by is it A, depression, B, exercise, C, sleep, or D, coma? Which one can cause a person's heart rate to increase? And yes, Renata and Kelly and Mimi and Karen and Irene, you have it correct. It is B, exercise. So, with that thought in mind, do you want to be doing or taking someone's vital signs right after you get them off of the toilet and walk them and put them back in a chair? So, I want you to be thinking about this because sometimes you all will do things after a patient has performed the activity, which will cause their vital signs to be abnormally high. So if you can, before you get them up to the bathroom, if they can just wait that 1 minute, can I get your blood pressure before I stand you and take you to the bathroom? Of course, if it's an emergency and they say no, well, then you just come back later. But if you can, do your blood pressures, your vital signs before you start moving your patients too much. And that way you will have the baseline vital signs and not something that is elevated. Question 23. The nurse aide notices on the flow sheet that a resident has not had a bowel movement for 5 days. You and that nurse need to be fired, period. The nurse aide should A, report this to the charge nurse, B, ask the other nurse aides if the resident has had a bowel movement that wasn't recorded, C, ask the resident's roommate if she saw the resident use the bathroom, or D, wait to see if she uses the bathroom tomorrow. I'm so happy you are great caregivers and all of you all chose A. Yeah, report that because we're about to give this person some heavy laxatives, uppers, lowers. When I say uppers, it's going to be pill form or maybe a liquid laxative. If we go lower, it's going to be a suppository or enema. So we're going to try to get something moving, but at no point should your patient go 5 days without a bowel movement. That is horrible. Question 24. A resident has refused to eat breakfast and lunch. The nurse aide should A, tell the resident's family to make him eat. B, tell the resident he will die if he doesn't eat soon. C, force feed the resident. Or D, report the refusals to the nurse for further assessment. And my rule of thumb is if a patient doesn't eat 50% or more of their meals for two or more meals, it is automatic. You come tell me. Because if they're only eating the carbohydrates, oh yeah, she ate the grits for breakfast and for lunch she ate the rice. She's still missing proteins and nutrients because she is not eating any vegetables or any meat. So you all notify the nurse it is going to be D because I can then go talk to the resident to see why they aren't eating and call the doctor to notify them and get supplements ordered. So we work together to keep these patients healthy. Question 25. A resident weighs over 300 pounds and needs to be repositioned in the bed. What should you do? A, tell the resident to lose weight. Well, it's not like they can lose it that quickly, so that she could be moved easier. B, tell the resident to wait until a strong person comes on the shift. C, get another nurse aide to assist in repositioning the resident. Or D, ignore the resident. She always complains anyway. Very proud of you. Very proud of you. All correct answers. You're going to get help from your teammate. It is going to be C. Assisting with repositioning a heavy resident requires teamwork to ensure safety for both the resident and the caregivers. And if you're still having difficulty, don't forget that your facilities have different type of devices such as Hoyer lifts, but even a Hoyer lift requires two people, one to keep a hand on the patient and the other to actually work the device. Question 26. A resident has just been admitted to the facility. The nurse aide should A, ignore the new resident. He has too much to remember anyway. B, introduce him to his roommate. C, announce his arrival at dinner. Or D, do whatever the charge nurse says. And I know there is no way you're going to be putting a patient in a room with someone else and you're not going to do B. I know you would never do something like that. That's just common courtesy. So, what you're going to do is introduce the new resident to their roommate because it helps to create a welcoming and inclusive environment, and it ensures that their transition to the facility will be more favorable. All right, question 27, everybody. And thank you for staying with us this long. Remember, we're going all the way to 100 questions. So, question 27, a diabetic resident asked the nurse aide to cut her toenails. The nurse aide should go ahead and do it as part of their job. B, tell the resident okay, but the resident will have to soak her feet first. C, tell the resident not on your life. Or D, tell the resident that the nurse aide cannot do this, but will report it to the charge nurse. Happy nurse dance, happy nurse dance. You all know that that is not within your scope of practice. So the answer would be D. Cutting the toenails of diabetic residents is outside the scope of practice for nurse aides, not just diabetic residents, for all residents. You all do not cut or clip anything. Due to the risk of infection or injury, that task should be reported to the nurse. So that is not your duty. You can file, but you cannot cut or clip. Question 28. To count a respiration, what does a respiration include? Is it A, one inhalation, B, one exhalation, C, one inhalation and two exhalations, or D, one inhalation and one exhalation? That was a mouthful. I'm going to drink water on that one. So let me just take a sip really quickly. And everyone has it correct. Take a deep breath in and then exhale. So it will be D. It's two movements for one respiration. So remember, we're going to take in the oxygen and we're going to let off the CO2, and that would be the entire process. So one full respiration consists of breathing in and then breathing out. And that's how you're going to get your full count. And remember, if you're counting for 1 full minute, the normal respiration rate for an adult would be 12 to 20 respirations per minute. The fire alarm has sounded. The nurse aide should do what first? A, ask the charge nurse for direction. B, make sure all residents are out of the hallway and close all doors. C, take the nearest fire extinguisher to the nurse's station. Or D, call the fire department. What do you do first? I'm so proud of you all. I am so proud of you. You all know that we're going to race. We're going to rescue first. So you all have it. You all chose B. You're going to get the patients out of harm's way and you're going to close those doors. Those doors are usually fire rated. So if you close the door, it gives you a few hours before the fire can penetrate the door. So it is B, ensuring your residents' safety by clearing the hallway and containing the fire by closing those fire doors is the priority during a fire alarm. So race is rescue. And then after you get your patients safe, you can A, pull the alarm or call 911. And then if you haven't already done C, confine, close off those doors. And then E is one of two different things. If you need to escape, you leave the building, you exit. But if you can extinguish the fire, you would go get the fire extinguisher. So it just depends on the size of the fire. Question number 30. If a resident is smoking and the nurse aide needs to take an oral temperature, remember when you're taking your CNA test, you're just not working in a hospital. You're anywhere where a resident or a patient would be. That could be a group home, it could be a assisted living facility. And yes, those residents in their group home, in their ALF, they may be allowed to smoke. So now going back to this question, if a resident is smoking and the nurse aide needs to take an oral temperature, what should the nurse aide do? A, brush the resident's teeth first. B, take a rectal temperature. C, wait 15 minutes to take the temperature. Or D, tell the resident to drink water first. Couldn't trick one of you. Everybody put C. Yep, we're going to have to wait to recheck that temperature because smoking can temporarily affect the accuracy of an oral temperature reading. Waiting 15 minutes ensures a more accurate result, and that goes whether they were smoking, eating, or drinking. Give their mouth time to normalize, to go back to a normal temperature. 31. What can the nurse aide give a resident who has an order for NPO? Do you give A, give fluids only, B, no food or liquids, C, small amounts of ice, or D, only clear liquids? NPO, what is your patient allowed? Dum, 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 dum. Yes, everybody, it is B. They are not allowed anything by mouth. So NPO, nothing by mouth orders, means the resident should not have any food or liquids to ensure their safety, typically before a procedure or test. That also means that if you do have a water pitcher in their room, that you empty the water pitcher. Because if you have a water pitcher that has water or ice in it and you tell a patient they're NPO, well, as soon as you walk out the room, they are just going to go get that water pitcher. So be diligent, be mindful. You don't want to be delaying your patient's test or making their illness worse. Question number 32. Which action would help prevent skin breakdown around a stoma if the resident had a colostomy? Is it A, clean the stoma with alcohol, B, use petroleum jelly around the stoma site, C, clean the stoma with water and mild soap, or D, wipe the stoma site with tissues until clean? I know this one's tricky. I saw a lot of D's, but sometimes just wiping it with toilet tissue, it sticks to the stoma. And so that's not good. So what we're going to do is see. It is going to be, we need to, all right, I'm trying to clean it with this tissue, but it keeps digging to the stoma. Let me go ahead and get a washcloth with some warm water and mild soap, and let me go ahead and clean around this site. So cleaning the stoma gently helps prevent irritation or infection. And we don't want to use alcohol or harsh substances or just continually keep wiping it with a tissue because the tissue is going to stick to the stoma and it's not going to help the appliance actually adhere. So you want to use, again, warm water and mild soap and then dry it off gently. Question 33. Residents in long term care facility depend on who for their safety? Is it A, the director of nursing, B, the safety risk manager, C, all employees of the facility, or D, the nurse aide? Who should they depend on? Think about when you go into a care facility. From the front door to the back door, who do the residents depend on for their safety? And if you said C, all of the employees, you are absolutely correct. Even the receptionist, she has to be alert. She's right in front of that elevator. So people are getting in, coming into the facility and leaving the facility. Safety starts at the front door. So safety in a long-term care facility is a collective responsibility requiring cooperation and vigilance, from all employees, including the nurse aide. 34. Mouth care should be given to an unconscious person how frequently? Not how frequently you think you have time, but how frequently according to textbooks. Is it A, once a day, B, every 2 hours, C, every shift, or D, every night? Remember, for your test, you have all the time in the world. You only have one patient to take care of. So, how frequently would you be providing mouth care to someone who is unconscious? Of course, they're probably mouth breathing, which is going to lead them to being more susceptible to having infections. And so, if you chose B, you are correct. So, not what we do in the real world. This is textbook. You're supposed to provide oral care to someone who is unconscious every 2 hours, utilizing an oral swab, what we may also call a toothette, because unconscious residents need more frequent mouth care to prevent dryness, infections, and complications like aspiration. Question 35. A hepatitis B vaccination protects the person receiving it against a disease that affects which organ? Is it the liver, the heart, the kidneys, or the skin? Why will your facility ask if you would like a Hep B vaccination? Which of your organs are they trying to protect? And I see a few correct answers, you all. Hepatitis is a virus that affects the liver. So the answer is A. Hepatitis causes inflammation that can lead to serious conditions like cirrhosis or cancer. Question 36. Why should heat not be applied to a diabetic resident's feet? Is it A, the feet have more oil glands? B, it makes their feet wrinkle? C, their feet are dirty? Or D, diabetics have decreased sensitivity, which means they cannot feel the heat and could cause a burn. I am so proud of you. Absolutely proud of you. Everybody chose D. You are absolutely correct. And so, a disorder or a disease that a diabetic could develop is called diabetic neuropathy. And that could reduce the sensitivity in the feet. Therefore, if you put a hot pack, if you've submerged their feet in hot water, they are going to be less likely to feel the heat immediately, which could result in a deeper or a worse type of burn. So you always want to check the temperature first and then have them maybe check the temperature with their hand and then their feet, because their hand is usually less likely to have the neuropathy or the decrease in sensation. Question 37. Which of the following will not assist bowel elimination? A, drinking a lot of water. B, using a bedside commode. C, taking a walk. Or D, reading the newspaper. Yeah. All right, that one's too easy, so I'm just going to reveal the answer. Unless it was a really crappy article, pun intended, there is no way that reading the newspaper is going to contribute to bowel mobility. So, reading does not contribute to physical activity or hydration, both of which are needed in order for bowel regularity. Question 38. Which will not prevent pressure sores? A, scrubbing and rubbing the skin vigorously. B, applying lotion to dry skin. C, keeping bed linens clean, dry, and free of wrinkles. D, repositioning or turning every 2 hours. And again, the question was, which would not prevent pressure sores? That is right. We don't want to be scrubbing and rubbing on thin, frail skin because we know that that is going to make an area that is bruised and more likely to open. So, A is the correct response. Gentle care is essential to prevent skin damage. Vigorous scrubbing can irritate the skin and increase the risk of breakdown, especially in vulnerable residents. And you all, if you've stayed this long, go ahead and give us a thumbs up, like the video. And if you haven't subscribed to our channel, go ahead and subscribe to our channel. We'd love to be your educators. And can help you pass not only your CNA tests, your CPR exams, your nursing exams. We try to be there for you because we know how important you are to the healthcare of people around the world. Question number 39. Water for a resident's bath should be what temperature? Is it 75 degrees Fahrenheit, 160 degrees Fahrenheit, 115 degrees Fahrenheit, or 99 degrees Fahrenheit? Now, if you think about old school, we used to have a thermometer that we stick in their water that would tell us the water temperature. And so, even though this question is asking you about a specific reading on a thermometer, remember the person that you're going to get this information from, they're not a thermometer. So, even if you have one and you choose the right temperature for the water, you always have your patient check that water temperature. And so, if you chose D, you are correct. You know that 99 degrees Fahrenheit is the ideal water temperature for a bath because it is very close to a normal body temperature. And so the range is anywhere from 90 degrees Fahrenheit up to 105. But remember, we're not giving baths to thermometers, we're giving baths to humans. So you can use the thermometer as a tool, but that human should have the overall say. All right, so question number 40. When assisting a resident with a weak left side from a wheelchair, which side should the CNA support? Is it A, the weak side, B, the strong side, C, the front side, or D, the back side? All right, so Mrs. Jones been in her wheelchair, and now you're going to take her from the wheelchair to the bed, and she has a weak side. Which side do you support? Yes, you are correct. It is the weak side. Supporting the weak side provides stability and helps to prevent falls or injuries when assisting a resident with mobility. Question 41. How should the nurse aide position the resident to apply elastic stockings? So those are those compression stockings, also referred to as TED hose. When you're trying to put those tight behind stockings on a patient, how do you do so? Should they be A, lying down in the bed, B, sitting on the edge of the bed, C, standing at the side of the bed, or D, sitting in the wheelchair? And everybody's getting this right. I'm so proud of all of you. Yes, you all A, lying down in the bed. Elastic stockings are best applied when the resident is lying down, as this ensures proper fit and minimizes swelling in the leg. Plus, you have to remember the reason for us even putting those on is because this person probably has peripheral vascular disease or circulation issues, which means when they stand, the blood can pool in their legs. So you want to put those on before they stand in order to help keep their blood pressure up. So you want to put them on while they're still lying in the bed. All right, question number 42. A resident's denture should be stored in A, tissue paper, B, an emesis basin, C, a labeled cup in water, or D, the utility room. How do we store these expensive dentures? And dentures cost about $6,000. And the facility doesn't want to be responsible for replacing them, so I need you to put them up where they should be put. And so if you chose C, you're right. It is a labeled cup. You're going to go ahead and take one of those patient labels. If you don't have a patient label, you're literally going to take a dry erase, not a dry erase marker, a permanent marker, and you're going to write it on the label and on the side. And so if they have maybe uppers and lowers, I would even put that information on the cup. Storing dentures in a labeled cup with water prevents them from drying out. It maintains hygiene and ensures they are easily identifiable. 43. The Heimlich maneuver, currently referred to as abdominal thrust, should be used if the resident is A, confused, B, coughing, C, choking, or D, diabetic. When do we perform abdominal thrust? I know this one's tricky, but I see a lot of correct responses. Remember, if someone is coughing, if they're doing B, you don't want to get behind them and start doing abdominal thrust, the Heimlich maneuver. If they're coughing, you want to encourage them to cough. So you do the Heimlich maneuver when C, when they can no longer cough, when they are not making any sounds, when they have their hands to their throat, making the universal choking sign. That's when you're going to say, "Hey, are you choking?" And you go behind them. You're going to go ahead and put your thumb, your fist right above their belly button, and you're going to do those upward and inward thrust. So the Heimlich maneuver is a technique used to relieve an obstructed airway in a choking individual. Remember, if they are coughing, they are not choking. Our next one, question 44. The nurse aide is going to take Mr. Heath's vital signs. What should the nurse aide do to get Mr. Heath to cooperate and reduce his anxiety? A, wash your hands before and after the procedure. B, gather all equipment before beginning. C, wear disposable gloves for all procedures. Or D, explain the procedure to Mr. Heath. Yes, 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 and yes again. I am so happy that you all realized that this wasn't about you just focusing on a procedure. It was about you focusing on his anxiety about the procedure. So it is D. You want to explain the procedure, reduce the anxiety, and ensure his cooperation by helping the resident understand what is expected. Question 45. What is the purpose of using a chain of command in a long term care facility? All right, so why don't you just go ahead and report everything to the director of nursing? Why do you have to follow the proper chain of command? Is it A, to keep communication about a problem flowing smoothly? B, to be sure residents follow the rules? C, to prevent residents from going behind the nurse's station? Or D, to provide more jobs in the nursing home? That is right. Oh, I cannot wait till my CNAs become nurses because you learn a whole new world. It's like, oh my God, I can't believe you went and told the charge nurse, the director of nursing on me, and you didn't even talk to me so I can explain it to you. Because sometimes things can be resolved by simply communicating. So, A, the chain of command is designed to facilitate clear and efficient communication, ensuring proper handling of issues within a facility. And now, once you've gone to your nurse and your nurse hasn't helped you or the issue isn't resolved, that's when you go to her supervisor, which may be the charge nurse. And if the charge nurse doesn't help you, that's when you go to her supervisor, which is the director of nursing. And I keep saying her, but we know that there are also men in the healthcare field. So I do apologize if I'm not including my male CNAs and my male future nurses. All right, question 46. Signs of poor circulation are A, flushed skin, B, perspiration and red skin, C, warm, dry, pink skin, or D, paleness, cold skin, and edema. What are signs of poor circulation? And everyone has it. It is D. All right. So poor circulation often results in symptoms like pale, cold skin, and swelling. Remember, if the heart isn't pumping, if the circulatory system isn't ineffective, that means that it's just going to pull in their legs, and that's when their legs start to swell. So that's what we mean by edema. And so that would be a sign of someone who has poor circulation. Get them to walk, get them to move their feet. And in some of your facilities, they're going to have these leg sleeves. They're called sequential compression devices, or SCDs. We'll usually put that on also in order to improve circulation. 47. A Foley catheter is used A, to drain fecal matter, B, to drain the bladder and remove urine, C, for gastric feeding, or D, to suction stomach contents. Yes, everybody, it is B. So this is not the best image, but it's the one that I found today. So a Foley catheter is a medical device inserted into the bladder to drain and collect urine, commonly used for residents with urinary retention or certain medical conditions. This is not the best urine because that bag should be always where. And if you said below the level of the bladder, you are correct. And so this just seems like a patient who is taking care of themselves, but if this is your patient in the facility, they usually have little hooks or little attachments on the wheelchair where you'd be able to attach that catheter so that it could just sit a little bit lower so it drains better. All right, question 48. When transferring a heavy resident from the bed to a wheelchair for the first time, do you want to A, use a mechanical lift? B, one person should always try to transfer the resident. C, the aide should review the care plan or check with the nurse. Or D, tell the resident they are too heavy for you to transfer. A heavy patient going to the wheelchair for the first time. You don't trust your own ability. You don't trust this patient. What is the best thing for you to do? You all, for this one, you want to check that care plan and check with the nurse because it may already say that transfers require the assistance of two or that transfers require a Hoyer lift. But when in doubt, regardless of the size of that patient, if you're getting anyone out of the bed for the first time, I would recommend that you have that nurse there with you. Or if the nurse is busy, she's going to delegate another CNA to be there with you. So, reviewing the care plan or consulting with the nurse ensures proper technique and safety during the transfer, especially for a heavy resident. But you all, those small, anxious patients are sometimes harder to transfer than a heavy patient. So, if you are unsure, just go ahead and ask. We'd rather you be safe than have a patient who is injured. Question 49. A pressure ulcer or decubitus ulcer is caused by A, burns, B, abrasions, C, fatigue, or D, inadequate turning. And this one's so easy. We're just going to go ahead and show you the answer. It is D, inadequate turning. So pressure ulcers develop when residents are not turned or repositioned regularly, leading to prolonged pressure on a certain area of the skin. 50. Diabetes mellitus make a resident more prone to develop A, chills, B, infections, C, obesity, or D, cancer. And I'm so proud of you for staying with us this long and doing your review. We are on question 50 of 100, so we are halfway there. And everybody who chose B, infections, you understand that diabetes impairs immune function and reduces the ability to heal, therefore making them more susceptible to infections, which is why we don't have you clip or cut anything on diabetic residents because and then some patients don't even know they have diabetes. That's why they're in the hospital to get treated to figure out what's going on with them. So a good rule of thumb is for you not to cut, not to clip, not to do anything that can cause an injury because that injury could be worsened if the person has diabetes and they do not heal fast. Question 51. A resident is NPO for test. The nurse aide should A, encourage fluids for hydration, B, allow the resident to eat ice chips, C, remove the water pitcher and glass from the room, hint, 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 or D, allow the resident to drink water. And if you've been here for this whole video, you know I've already covered this one. So the response is going to be C. Whenever a patient is NPO, all food and drink must be withheld, including water, to ensure compliance with medical orders and safety during the procedures or tests. A lot of these procedures require sedation, and we don't want a person who's had something to eat or drink recently on an operating table, on a procedural table, and then we give them sedation because they're going to become nauseous and they could vomit. So we need to keep their stomach clear. So that would be another reason. Just think of the safety behind it. If we're telling you the patient shouldn't have anything to eat or drink, there's usually a medical reason as to why. And if you don't understand it, don't be afraid to ask your nurse for clarity. Question 52. The nurse aide is assigned to a resident with a diagnosis of aphasia. The nurse aide knows that aphasia means A, the resident cannot walk, B, the resident cannot swallow, C, the resident cannot talk, or D, none of the above. So this one is spelled differently. So this is not aphasia. This is aphasia. I know they sound similar, right? So, all right, revealing the answer in three, two, and Chrissy, Ruth, Mirtha, Barad, you have it. It is C. The resident cannot talk. So, this happens also after a stroke. So, aphasia refers to an impairment of communication, often caused by a brain injury of stroke that affects the ability to speak or understand language. I'm so proud of you. Question 53. The nurse aide is caring for a diabetic resident. The nurse aide finds the resident trying to scrape off a callus on the little toe. What should you do? A. Scold the resident. B. Put socks on the resident to keep the resident from scraping. C. Help the resident remove the callus. Or D. Report the behavior to the nurse. Yeah, this was tricky. It definitely wasn't C. Remember, a diabetic patient who is trying to be their own podiatrist and remove a callus from their foot could actually cause themselves to get an infection. So, you all above your pay grade, you get that nurse in a room. It is D. Report that behavior to the nurse because diabetic residents are at higher risk of infections and complications. A nurse must assess and manage issues like calluses removal to prevent injury. Plus, she needs to go in there and see what this resident has already done. Is there an opening? Is there an infection? Maybe she can put like I'm going to say Dr. Scholl's pad for lack of a better term, but maybe she can put a cushion or something on that area until the doctor can get in and evaluate it. Question 54. The exchange of oxygen and carbon dioxide takes place where? Is it A in the lungs, B in the heart, C around the kidneys, or D in the intestines? Oxygen and carbon dioxide. Where does that exchange take place? Yes, you all know your anatomy and physiology. It is A. Gas exchange occurs in the alveoli of the lungs, where oxygen is absorbed into the bloodstream and carbon dioxide is expelled. Question 55. Which of the following patients requires airborne precautions? Ooh, is it A, patient with influenza? B, a patient with tuberculosis? C, a patient with a surgical wound infection? Or D, a patient with C. difficile or C. diff? Which one requires airborne precautions? I hope you're as proud of you as I am of you because you all have been rocking this test. You all have been getting almost every answer correct. You understand this material. So, everybody, it is B. Airborne precautions are necessary for diseases such as tuberculosis, short is TB, measles, and chickenpox, as these infections spread via tiny particles that remain suspended in the air. Question 55. The nurse aide is making a bed with an unconscious resident in it. Which of the following is the most appropriate? A. Be quiet and concentrate on your work. B. Don't explain because the resident can't hear you. C. Explain what you are doing to the resident. Or D, talk to your coworker while you make the bed. Remember, this person is unconscious. So, how do you want to take care of somebody who isn't responding to you? Hmm. And for this one, Barad, it is not D. You're going to talk to that person. It is going to be C, because even unconscious residents should be treated with dignity and respect, which includes explaining actions to foster a sense of care and consideration. And then the last sense that reportedly goes is the sense of hearing. So even though this person may not physically be able to respond and interact with you, they may still be able to hear you. So it's going to be, hello, Mr. Lucas. Hey, I'm Nancy. I'm your CNA today. I'm here to give you a bath. You're just not going to be there quiet and don't speak to them, give the bath, and or hold a conversation with your coworker throughout the entire bath. So include your patient in their care, whether they can communicate with you or not. Question 57. What is the best response when a patient is upset and refusing care? Nurse Eunice, get out of my room right now. Is it A, ignore the patient until they calm down? B, immediately contact the nurse for assistance? C, speak calmly and listen to their concerns? Or D, force the patient to accept care? This patient doesn't want you in their room. Hey, what do you want to do? If your answer for this is always go get the nurse, you are never going to overcome objections or rejections from your patients, and you're not going to be able to get anything done. So, if your patient is refusing care and they're not being abusive to you, you are going to do C. You're going to speak calmly and listen to their concerns. Find out their why. Why don't you want a bath? Why don't you want to eat? Can you explain to me what's happening to you right now? Because effective communication involves listening and addressing the patient's concerns calmly. This can help to de escalate the situation. You will make a friend because you're building trust with your patient, and then they will be more likely to say yes instead of saying no to everything. We'll actually get some work accomplished. Question 58. When receiving a verbal order from a nurse, what is the CNA's responsibility? All right, so you're the CNA, I'm the nurse, and I say, hey, I need for you to go ahead and get a stool collection on the patient in a stool sample, excuse me, on the patient in 356. So, do you want to A, write down the order in the patient's chart, B, repeat the order back for clarification, C, carry out the order immediately, or D, refer the order to another CNA? I gave you a verbal order. The doctor is giving me an order. I wrote the order down. That is the nurse's job. So, what is your job as the CNA? And if you chose, ding, 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 if you chose B, you are correct. You want to repeat the order back. Okay, Nurse Eunice, you want me to collect stool on the patient in room, blah, blah, blah. Is there a reason? Hey, because you probably want to know if this person has C. diff, if we're trying to rule it out. So, and remember, with your nurses, it is okay to ask questions. You just got to ask questions in a professional manner that's not demeaning. So, you're going to learn a lot, and your nurses will also learn a lot from you. We're a team. Question 59. The loss of the ability to express one's self is A, verbal communication, B, empathy, C, speech therapy, or D, aphasia. When someone can't express themselves, hmm, we just covered this a few questions ago. So, what do you think, team? Stephanie, you have it. It is correct. It is D. It is aphasia. So aphasia is the inability to express, verbally communicate. One's so it says here unable to express oneself or understand language, and that usually happens after a neurological issue such as a stroke. Question 60. To remove a hearing aid, what should you do? Do you want to A, turn it off with the volume set at low? B, leave it on and set the volume at high? C, call the nurse? Or D, turn the hearing aid off with the volume set on high? Ouch, just even reading D made my ear hurt. So you all, it is not D. Have you all heard that echo that the hearing aids make when they're turned up too high? Imagine you turning it on and it makes that loud screech. So the answer is not D. Kalia, or excuse me, Celia? Let's see, let's see. All right, for this one, y'all don't have to call the nurse to remove a hearing aid. It's going to be A. You can remove a hearing aid. You don't want to be like replacing batteries and stuff, but the same cup that you use, something or at least a similar cup that you place the dentures in, you're going to label a separate cup and it's going to say hearing aids. And if they have their left and their right hearing aid, you're going to make sure that you put that on the actual cup. So if I go in and I only see one hearing aid in the cup, I'm immediately on high alert. Where's this other hearing aid? But your hearing aid should have like a little button or a circular device that you can use to turn it off and on. But you always want to do A when you're turning off the hearing aid, set it to a low volume so that when we turn it on, we don't hear that loud pitch or that high pitched squeak. It's a really annoying noise. Once you hear it once, you'll know exactly what I'm talking about. Question 61. Negative body language would include A, touching a resident's shoulder while talking, B, leaning toward the resident to communicate, C, shaking hands, or D, placing your hands on your hips. What would be negative body language? What could make a patient intimidated? It's not A for this one. A, I could understand sometimes, but there's one that's worse than A. Yes, Joseph. Yes, Etienne and Uchi and Mirtha, you are absolutely correct. So I need you all to be very mindful of how you hold your hands when you go into these patients' rooms. You shouldn't have your hands behind your back. You shouldn't have your hands clutched in a fist. I know that sounds strange, but some of you all do that. And you definitely should not do D. Have your hands placed on your hips, because placing your hands on your hips can convey frustration, impatience, or aggression, which may create discomfort or tension when interacting with a resident. So those hand placements matter. If you don't know how to have your hands, I don't care how mad this patient's made you, hold a clipboard in one hand and a pen in the other. And that way the patient doesn't know that you're extremely ticked because you are squeezing a life out of a clipboard and a pen versus clenching your fist together. Question 62, everybody. What is the best way to talk to a vision impaired resident? Do you want to A, touch the resident before you begin talking? B, talk loudly? C, use hand gestures and body movements? Or D, verbally announce your presence before touching the resident? And then Barad, look like you have an answer there from Elise. So everybody, whenever you are interacting with someone who has a visual impairment, you don't need to talk loudly. You don't need to touch them before you begin talking. You want to say, hey, Mr. Lucas, I'm Eunice. I'm your CNA. I'm in your room. I'm here to start cleaning you. How are you doing today? So you want to do D. Verbally announce your presence to help avoid startling a visually impaired resident, and it ensures they are aware of your intentions. So just don't walk up to them and start touching them. Announce yourself first. Question 63. The most basic rule of body mechanics is to A, keep the arms flexed, B, use your back muscles, C, bend from the knees and the hips, or D, never use a lift belt. What is the basic rule of body mechanics? How do you maneuver people? How do you maneuver heavy objects? Let's see. Let's see what your responses are. And everybody has it right. I'm glad you protected your back and you did not choose B. The answer is C. Bend from the knees and the hips. Use those strong leg muscles to lift. Question 64. Proper body mechanics dictate that when lifting an object, the nurse aide should place his feet how far apart? Is it A, 3 to 5 feet apart, B, 6 inches apart, C, 12 to 18 inches apart, or D, it doesn't matter. All right, you're doing range of motion exercises. You're helping to lift someone's leg up and down from the bed, back to the bed. How far apart should your legs be when you're assisting them? And I see a couple of different answers, but it'll make sense in a moment. It is C, everybody. So we usually like to tell you to stand to like have your legs pretty much at the same distance as your hips, a little bit or a little bit farther out. And so you want to have a good stance, or about a foot away from each other. That's how far your feet should be. So keeping the feet 12 to 18 inches away provides a stable base for lifting, and it reduces the risk of injury, ensuring proper balance. 65. Which of the following beverages should be avoided by a patient who is dehydrated? Is it A, water, B, electrolyte solutions, C, sports drinks without added sugar, or D, caffeinated coffee or tea? Yep, I see you, Irene. I see you, Uchi. I see you. You have it correct. It is D, because we know that caffeinated beverages act as diuretics. So they're going to make you urinate. So if you give someone who's already dehydrated coffee, well, you just made their dehydration worse because they're going to have to go urinate. So caffeine is a natural diuretic. You want to try to avoid it if the person is dehydrated. Question 66. A nurse aide knows to wear which of the following to perform resident care? A, comfortable, clean clothes. B, non-skid shoes. C, loop earrings. Or D, long fingernails. And for this one, it's two answers. So, what should a nurse aide wear to perform patient care? What are the two responses? Yes, I see them. Everyone's choosing A and B. You are correct. And so the next slide is incorrect, but you're correct. All right. So you can do A or B, because nurse aides should wear comfortable, clean uniforms and non-skid shoes to ensure hygiene, professionalism, and safety during care. You cannot wear loop earrings. Remember, these patients can sometimes be confused and they can pull on things, which means they can pull your earring and rip your ear. And you don't want to have long fingernails because they harbor germs, and they can also cause injury to patients when we're trying to lift or clean them. Question 67. Which of the following patients is at the highest risk for dehydration? A healthy adult drinking adequate fluids. B, an older adult with diarrhea and limited mobility. C, a teenager playing sports who drinks water. Or D, a pregnant woman with a balanced diet. Who is more at risk of dehydration? And remember, if they get dehydrated, then they're going to get a UTI, and then they're going to get confused. So our job is to prevent this stuff from happening, and we have to know what population would be at the greatest risk. So it is B, older adults are more prone to dehydration due to reduced thirst sensation and diarrhea, which can also increase fluid loss. 68. Which environment promotes the growth of bacteria? And this is just a lot to read. So I'm going to let you all read this while I take a sip of water. And if you're just joining us, we're going all the way to 100 questions. So go ahead and like the video, subscribe to our channel if you haven't, and I'll reveal this answer in about 5 seconds. All right. Thank you for letting me take a sip of water. Everybody, the answer is, I think Etienne, I hope I pronounced your name correctly. I think she has it. Bacteria. Or think about fungi or fungus between the toes. They like dark, warm, moist places, the crevices, the cracks. And so bacteria thrive in dark, warm, and moist environments, which promote their growth and reproduction. They don't grow too well in the cold. Question 69. Used medical equipment. Example, a bedside commode. Right here in the hospital, we don't throw those bedside commodes away when a patient uses one. What do you do with it when they are finished? Do you A, put in the resident's wastebasket, B, in the dirty utility room, C, in the clean utility room, or D, in the bathroom wastebasket? So Mrs. Lucas had an order for a bedside commode, but now she's discharged. What do you do with that dirty commode? All right, I see I'm teaching you all something different. So this is not a bedpan. This is like that porta potty. It has the handles. This is a big piece of dirty equipment. You're going to take it to the dirty utility room. So it is B. Use disposable supplies and equipment. If it needs to be discarded or cleaned, you take it into a dirty utility room, and then they usually have a specialized department who will come in and remove the waste and or clean that used equipment. Think of a wound vac. When a patient's done with a wound vac, we don't get to just throw it away. It has to be sanitized, and you need to take it to an area so that someone knows where it's dirty, and that would be that dirty utility room. Question 70. A low sodium diet is most commonly prescribed for patients with A, diabetes mellitus, B, dehydration, C, chronic kidney disease, or D, hypertension or heart failure. So who gets a low sodium or a low salt diet? All right, love Letitia. We can't wait to hear about your test date. Good luck in advance. And for everybody who chose D for 70, you are absolutely correct. Remember, all that fluid follows the salt. And this person who has hypertension, they already have issues with their circulatory system. If they have heart failure, the heart can't pump already. So we don't want to give them more salt that's going to bring in more fluid and make their situation worse. So a low sodium diet helps manage fluid retention and blood pressure in patients with hypertension or heart failure. Question 71. Mr. Jones is in her, excuse me, Mrs. Jones is in her wheelchair in the hallway stating she needs a pillow behind her back. What should you do as the nurse aide? A, get Mrs. Jones' pillow from her room and place it behind her back. B, get any pillow and put it behind Mrs. Jones' back so she'll stop complaining. C, tell Mrs. Jones that a pillow is not good for her back. Or D, nothing is needed because Mrs. Jones always says her back hurts. Well, how dare you, Mrs. CNA, to choose D because she always says her back hurts? Well, maybe it always does because you didn't do A. You didn't get her pillow. So A, providing a pillow for her meets Mrs. Jones' comfort needs and demonstrates respect and attention to her request. All right, question 72. Mr. Spalding's daughter requests that the nurse aide perform mouth care for Mr. Spalding. The nurse aide should A, perform the care as soon as possible after other required tasks are done. B, put on gloves and perform the requested care. C, tell Mr. Spalding's daughter that mouth care was done about 30 minutes ago and doesn't need to be done right now. D, wash his or her hands, put on gloves, and perform the requested care. I think this one was a typo. So if two answers is okay for this one. All right, so let's see. I'll reveal the response in 3, 2, 1, but I think it's D. I'm just not sure if I chose D. I did choose D. Whew. All right, because we actually washed our hands. All right. And so don't forget that when you're taking your CNA examination, and I talk to a lot of nurse educators, we find that we don't care how much we tell you guys and you gals to wash your hands before and after your skills. You get in that testing center and you forget to wash your hands, which means that you are going to be unlikely to pass. So before you perform any skill, you're going to make sure your hands are clean. And then the answer is D, because performing mouth care properly while maintaining proper hand hygiene practices ensures safety and compliance with standard care procedures. Plus, it addresses Mr. Spalding's daughter's request because maybe she saw something that you didn't, even if you did brush your teeth or provided mouth care 30 minutes ago. It doesn't mean that the patient hasn't had a change, had more saliva, or maybe they've eaten something now and now they need to have oral care again. So thank you all for providing great care to Mr. Spalding. Question 73. Which of the following is the most reliable indicator of adequate hydration? Is it A, thirst, B, skin elasticity, C, urine color and output, or D, daily weights? How do we know this patient's getting adequate hydration? All right, I see a correct response. Joseph, you have it. Etienne, Rayon, Felicia. Yes, you have it. It is C. All right, urine color and output. Clear, light colored urine and adequate output are reliable indications of hydration status. Question 74. After Mr. Johnson's bath, the nurse aide realizes she needs another towel to completely dry Mr. Johnson. The nurse aide should A, use what appears to be a clean towel left in the room by another aide. B, ask another staff member to obtain a clean towel for her from the clean linen cart. C, tell Mr. Johnson you'll go back to his room when he air dries. Or D, ask Mr. Johnson if he's dry enough to continue to dress himself. Well, a lot of those seem like you would be leaving your patient wet. So we don't want to leave them wet. So the correct response must be B. You're going to ask for help. Press that call bell and say, hey, can someone bring me some towels in the room? Because using a clean towel maintains hygiene and dignity for Mr. Johnson, and seeking assistance ensures uninterrupted care. It should be easy. Even the secretary can just run to the door really quickly and bring you a towel. So don't be afraid to ask for help if you need it. Question 75. During a bed bath, Mrs. Smith uses a washcloth to clean her perineal area and then puts the washcloth into the basin of water. But the nurse aide needs to wash Mrs. Smith's face. Y'all are unorganized in this bath. I mean, the right hand doesn't know what the left hand's doing. But now that we've made this mistake, what should you do as the nurse aide? Is it A, scold Mrs. Smith for washing her perineal area first? B, do nothing and continue with the bath? C, obtain a clean cloth, change the water in the basin and continue the bath? Or D, let Mrs. Smith give the bath the way she wants to do it? Ew. The way that she wants to do it is putting germs in her eyes. We're not doing that. So what is the correct response, team? Yes, it is C. And you got to move faster and talk to her. Be like, all right, we're going to start off with the cleanest area first. So it is going to be C. You're going to have to change the water and use a clean cloth because we don't want to have any cross contamination. We don't want to have fecal matter going to someone's face. But in the future, you could provide more direction. If she wants to assist, remind her to assist by cleaning her face first, and then we can wash the rest of the body afterwards. Question 76. What is the best response if you are not sure how to use a piece of equipment? A, do the best you can. B, don't use the equipment. C, find a different way to complete the task. Or D, ask the nurse to explain. Yes, Priscilla and Rose. Yes, remember we're teammates. If you don't know how to do something, I just can't send you out there blind using a piece of equipment. It is going to be D. I'm going to hope that you're going to ask me to explain how to use this particular piece of equipment, because seeking clarification from the nurse ensures proper use of the equipment. Plus, it maintains safety and it helps to avoid errors. Question 77. The nurse aide is making an occupied bed. Which of the following is the most restorative approach? That word restorative, what does it mean? All right, so A, encourage the resident to help. B, do everything for the resident. C, tell the resident to get out of the bed. Or D, lower both side rails. Restorative care. Hmm. Let's see. I'll reveal the answer in 5, 4, 3, 2, and yes, everybody got it right. You want to encourage the resident to help. We're trying to restore. We don't want to be doing everything for you. I'm going to encourage you through this process because encouraging the resident to participate promotes independence and supports a restorative care approach. All right. If the goal is to get you home, well, let's act like it. I can't say that to a patient, but that's what I'm thinking. All right, Miss Lucas, let's see if you can feed yourself today. Let's get you to wash your own face because we're trying to restore whatever functions they had lost before their illness, before their stroke, so they can get back to a higher level of quality of life. Question 78. The primary goal of restorative care is to A, keep the residents comfortable in the nursing home. B, take care of the resident's personal business. C, do everything for the resident. Or D, return the resident to a normal life at home. If someone's in your facility for rehab, that is restorative care. What is your goal? And yes, you all have it right. It is D. The goal of restorative care is to help residents regain independence and function to the fullest extent possible, ideally return them to their home environment. 79. Equipment used to help the residents maintain correct body alignment includes all of the following except A, foot supports, B, cones, C, splints, or D, bed cradles. All right, you got to be a little bit old to know what a bed cradle is, but yes, there are devices that are called bed cradles. So the answer is not D. So which one is not something we use on a patient for alignment? Waiting for 2 more responses. So far, I see a few correct responses, but I don't see enough. All right, we'll reveal the answer in 3, 2, and Rose and Rihanna and Adeline, you have it. There is not a device that we use for body alignment called a cone, but equipment like foot supports, splints, and bed cradles are designed to help keep a patient in position. Question 80. The plan, which begins on the resident's admission that assists when the resident goes home, is called. So we're talking about the resident's admission, but now we're talking about going home also. So there's a plan for that. What is the plan called? Is it A, the treatment plan, B, the nurse aid flow record, C, the discharge plan, or D, the care plan? This one specifically mentioned going home. So what plan are we referring to? Yep. Anna Marie in this case and Felicia is not D. So the care plan is usually focused on the care they're receiving in that facility. The discharge plan is the correct response. So it is C. That talks about whether they need home oxygen, if they're going to need a walker, do they need nurses, physical therapy. So a discharge plan is developed upon admission because we're asking them questions like, hey, who takes care of you at home? And if they say nobody and they have a severe condition, well, we can't send them home. We send them to a nursing home or an extended facility so they can receive care. So those questions that we ask upon admission help to direct their discharge planning. So a discharge plan is developed upon admission to prepare for the resident's eventual return home, ensuring continuity of care and support. Question 81 of our 100 questions team. We are almost done with our holiday. If I didn't tell you already, because you came in a little bit late, happy Thanksgiving. All right, so which of the following foods is the most appropriate for a patient at risk of malnutrition due to weight loss? Is it A, nutrient dense snacks such as nuts and yogurt? B, fried foods and desserts? C, processed foods high in salt? Or D, low calorie foods with minimum, let's see here, minimum protein? What is best for someone who's at risk of malnutrition? Hmm. Yes, Rayanne and Hamdi and Chrissy, we want to give them something that's going to pack a punch. So it needs to be nutrient dense. It is going to be A. Nutrient dense foods provide vitamins, minerals, calories, and also some protein to help support weight maintenance and overall health. Question 82. A mentally challenged resident is having difficulty cutting and eating her roast beef. What should the nurse aide do? A. Feed the resident. B. Cut the meat into smaller pieces, allowing her to feed herself. C. Tell her to chew the big pieces longer. D. Take away the roast beef. I don't know. I think if you do D, you're just mean. She didn't say she didn't want to eat it. She's just having a hard time cutting it. So yes, Zebonay, yes, Rayon, yes, Darvalier, you want to do B. Cutting the meat into manageable pieces enables the resident to maintain independence in eating and supports their dignity and self-reliance. 83. When the nurse aide moves a joint during ROM or range of motion exercises and the resident complains of pain, the nurse aide should A, push past the point where the pain occurs to see if it hurts worse. D, ask the nurse to give pain medication so the exercises can continue. C, stop the movement at the point the pain occurs and report it to the nurse. Or D, stop giving the resident any ROM exercises. This one's a little bit tricky. Hmm. Well, I thought it was tricky, but I see you all have the right answer. So, my apologies for underestimating how smart you are. Everybody, it is C. You're going to stop at the point of pain. Don't just keep going and don't ask the nurse for pain medication to mask the issue. The issue is that maybe this patient isn't right for you to be doing range of motion on them right now. Maybe there's a hairline fracture. Get the nurse in the room. So stopping at the point of pain prevents injury, and reporting the issue ensures appropriate assessment and management by the nurse. Remember, if we just give them a pain pill so you can keep doing the job, we never address the underlying issue, which could be a fracture that no one knows about. 84. A contracture, tightening or shortening of a muscle is caused by A, laziness, B, lack of movement of the muscle, C, pressure on the muscle, or D, old age. What is a contracture caused by? So not a contraction as if someone's pregnant, a contracture when that muscle shortens. And I see B's and I see a D and now I see a C. So we have all of the alphabet except for A. And I'll reveal the answer in 5 seconds. So 4, 3, 2, and Nikisha just gave us an emoji like, I don't know this one. And so you all, contractures are caused by the lack of movement. So it is B. Contractures result from prolonged immobility or the lack of use, leading to muscle shortening and stiffening. My CNAs, you're going to see this happening first. The body has a tendency to curve inward. Your job is to prevent it from curving inward. Use pillows, use supports, notify the nurse. We can get an arm brace, we can get a leg brace. And so when those patients try to, roll into a fetal position, if we don't catch it in time, they get stuck like that. So anytime you think of contracture, think of a patient who is stuck, who is now locked. And it takes a lot of time, a lot of just gradual movement in order for us to prevent that contracture or to open it back up. If their hands start rolling in, you can take a washcloth, you can fold it and roll it into a roll, for lack of a better term, and you can put that in their hand to prevent their hand from curving in more. So there are always ways. And let me also say this. I know you're like, well, why didn't the nurse catch it? Because if you're in a long-term care facility, there's probably one LPN to 30 or 40 patients. And she may only work at that facility one time a week. So she doesn't know this isn't this patient's normal. You will know because you are there 5 nights per week. And so you may have to tell the nurse that this is not the patient's normal so that she can get that order put in for the doctor or the physical therapist to come in and evaluate that patient. Okay, so I hope that helped you understand why the nurse didn't see this, because sometimes it's an agency nurse who just doesn't know the patient's baseline. Question 85. The nurse aide documents that about 45 minutes after the resident is put to bed for an afternoon nap, the resident urinates in bed. To help with bladder training, the nurse aide should, is it A, take the resident to the bathroom right before going to bed, B, scold the resident for always messing up the clean bed, C, report to the registered nurse that the resident will not succeed in bladder training, or D, take the resident to the bathroom after about 30 minutes of being in bed for the nap. Man, if you put me to sleep and then wake me up talking about going to the bathroom, I'm going to ruin the rest of your day. I'm going to call you every 5 minutes. So please don't do D. What is a better response, friends? Yes, everybody. It is A. Take them to the bathroom before they go to bed. So assisting a resident to the bathroom before lying down for a nap is an important step in bladder training, as it helps to empty the bladder and reduce the chances of me calling you every 5 minutes if you wake me up after you put me to bed. Oh, we're going to have a rough shift. All right, question 86. Mr. Schwartz is concerned about his son and asks to speak with his rabbi. What should you do as a nurse aide? Do you want to do A, ask the nurse if rabbis are allowed in the facility? B, ask the nurse to contact Mr. Schwartz's rabbi and invite him to visit? C, tell Mr. Schwartz his son is going to be fine and not to worry? Or D, tell Mr. Schwartz's family about his request? What is your scope of practice as the CNA? What should you be doing? Yes, Chrissy and Rose and yes for 2 and Barad, you have it. You're going to get that nurse in the room because the nurse can contact the rabbi and schedule the visit. Question 87. The nurse aide reported bruises on Mr. Jenkins' arm last week. Today, during AM care, there were more bruises. What should you do as the nurse aide? A, do nothing. Mr. Jenkins did not complain. B, tell another nurse aide to report the new bruises. C, report the abuse again, this time to a different nurse, or call the abuse hotline at the state office. Or D, call the police because nothing has been done. And I see so many correct responses. It is C. Oh, we have to report that. We are mandatory reporters. So if I've already told this nurse about the bruises and the nurse hasn't done anything, maybe she didn't do anything because she's the one who's abusing the resident. So reporting suspected abuse is mandatory. And if no action has been taken, escalating the report ensures the issue is addressed. So you all, great job with question 87. Question 88. Once a nurse aide's name is placed on the abuse registry for neglect, he may A, never work as a nurse aide again, B, continue to work as a nurse aide as long as he abuses no one else, C, work only with young children, D, petition a nurse aide program to have his name removed from the abuse registry after 1 year. And so, if you don't understand the scope of practice, don't forget that for every state, there are laws that CNAs and that the governing bodies must abide by. And so, for this one, it is going to be D as in dog. So, just because something's on your record, maybe it's been cleared up, maybe you can ask for an exemption. So, D, nurse aides can petition for the removal of abuse from the registry after demonstrating compliance with regulations and completing required steps. So if you do everything they ask you to do, then hopefully they can either make you exempt or they can remove that from your record altogether. Question 89. A nurse aide reclines a resident into a jerry chair so the resident cannot attempt to stand. This is a violation of A, the resident's right to cooperation, B, the resident's right to be free from restraints, C, the nurse aide to practice safety for the resident, or D, the resident's right to walk. All right, so you lean that chair back so Mr. Miller cannot get up. That was fun. You had a few moments of freedom, but you also did B. You violated that patient's right to be free from restraints. You used a chair as a restraint. So, recline a resident to prevent standing without justification is considered a restraint, violating their right to freedom from unnecessary restrictions. And so, if you're reported for doing that, not only could you be written up, you could also face a lawsuit. Remember, there has to be a medical reason and a doctor's order to restrain a patient. Question 90. Mr. Joseph overhears the nurse aide speaking to the nurse about his roommate's diagnosis and demands that the nurse aide discusses the roommate's condition with him. The nurse aide should A, firmly but politely explain she cannot discuss another resident's condition. B, tell Mr. Joseph that that is not his concern. He should worry about himself. C, tell Mr. Joseph to ask his roommate's family. Or D, tell Mr. Joseph that if his roommate wanted him to know, the roommate will tell Mr. Joseph. All right, so I'm just going to give Mr. Joseph a very appropriate name. I'm going to call him Mr. Nosy. What's going to be your best response for Mr. Nosy? Yes, it is going to be A, Chrissy and Zebedee and Karen and Nichelle. It is A. Confidentiality is fundamental. And it's the nurse aide's duty to protect the privacy of the other resident. And so you're going to firmly but politely explain that you cannot discuss that resident's condition. 91. During post-mortem care, so after death care, the CNA notices jewelry on the deceased. What should the CNA do? A, remove and store the jewelry immediately. B, leave the jewelry on the body and do not document it. C, document the items and leave them in place until the family or nurse provides instructions. Or D, distribute the jewelry to family members present. All right, so this deceased resident still has jewelry on them. What do you do as the CNA? Everybody got it right. It is C. Document. Cover your butt. CYB. Document in the presence of valuables and awaiting instructions ensures accountability and respect for the belongings of the deceased. So that's the textbook answer. The real world answer is you don't want anyone to say that you stole the jewelry. So you're going to make sure that you document what was there and that you notify the nurse. You just don't want to take the jewelry off and give it to a family member because the family member could lie and say that you never gave them the jewelry. And so on the sheet where we document the patient's belongings, if we are giving the belongings to a family member, there's a place where they would have to actually sign that they received the documentation. So document it, include the nurse, and that way you stay out of trouble, which is important. You don't want your license or your name or reputation being ruined because someone lied and said that you took jewelry. Question 92. A CNA is preparing to provide post-mortem care. What is the first step? A. Confirm the patient has been pronounced deceased by a licensed provider. B. Wash and position the body respectfully. C. Notify the family to enter the room. Or D. Remove all medical equipment and tubes. Excuse me. So you've been called into a room to assist with post-mortem care. What's the first thing you need to be checking for? And I see we're all around the world on this one, but we actually have to have an order to provide postmortem care because the doctor would have had to pronounce that person as deceased. So the answer is A. Postmortem care begins only after the patient has officially been pronounced deceased by a qualified healthcare provider. This ensures proper documentation and respect for the deceased. Look, sometimes you all get busy, and it could be a person who is in there unconscious, who has not been pronounced deceased. We don't want you all in there trying to put the wrong person, somebody who's still breathing, in a body bag. So you check those orders, you check with that nurse, but there should be a physical order for post-mortem care. And also, it's going to document the date and time of the person's death. Question 93. What are the two kinds of restraints? Is it A, mask and goggles, B, chemical and medication, C, belts and wristbands, or D, chemical and physical? Yeah, this one's tricky. This one is tricky. At least I thought it was tricky, but Fatu and Priscilla and Laura and Felicia and Zebonay and Karen, you all have it. The two types of restraints are chemical and physical. So restraints were classified as either or, what I just said. And so this is how it usually starts off. And so we're going to start off with those physical restraints. If a patient is combative, they're trying to hurt themselves, they're trying to hurt other people, we're going to put those soft restraints on them. But soft restraints for behavioral purposes require so much monitoring. Like we have to check them every 15 minutes, check their vital signs, et cetera, et cetera. But that's going to allow that nurse enough time to start an IV. And if the patient has a UTI and maybe that's the cause of their confusion, we can start antibiotics, we can start fluids. But there are some patients who are going to need a sedative. And so if we have to sedate them to change their behavior, that is called a chemical restraint. And so usually after we give them that chemical restraint, eventually we'll be able to remove the physical restraint. So we start off with the physical, and then we go to the chemical, start some IV fluids, etc. And then hopefully we can unrestrain them or release the restraints. And so it is a process. It can take maybe 24 hours, but the goal would be for that patient to be restraint free within 24 hours. We do not keep our patients tied down or chemically restrained for too long because we know that increases their chances of disability and death. All right, so our next one, everybody. Question 94. Mr. Smith refused to take a bath. The nurse aide bathed him anyway. Man, y'all are trying to get in trouble. What right was violated? A, the right to be free from odor. B, the right to privacy. C, the right to refuse treatment. Or D, the right to complain. How you get in trouble for doing your job? Because the patient refused. They didn't want a bath. So guess what you do, everybody? You respect their wishes. You do see, because residents have the right to refuse treatment, including bathing, and forcing them to undergo it violates their rights. So let's talk about this documentation. What are you going to do? You're going to ask twice. You're like, okay, Mr. Lucas, is it okay if I give you a bath? No, I don't want a bath. All right, Mr. Lucas, I'll try again later. But for that first attempt, you let your nurse know and you document in the chart that you attempted the bath, you notified the nurse. And now you go back 4 hours later, and let's say it's 4 p.m. Hey, Mr. Lucas, is it okay if I give you a bath now? And he says no again. Repeat that process, notify the nurse, because now it's the nurse's job to get in there to figure out what's going on with that patient, or we can see if he'll want a bath on night shift. But remember, we don't give these patients baths strictly because of body odor, because a lot of them don't sweat sweat as much. We have to do a skin assessment. We need to see what's going on with their body. So if you're not able to see the skin, that means that nurse needs to. But I need you to document to cover your own assets and your own license. Question 95. You observe your coworker verbally abusing a resident. What should you do? A, talk to her after work. B, tell the resident's family. C, do nothing. Words don't hurt the resident. Or D, report it to the charge nurse. And this one's easy, so I'm going to show the answer in 5, 4, 3, 2. Oh, you're not verbally abusing my residents. I'm going to talk to you. Hey, Miss Eunice, I need you to stop. I hear how you're talking to her. I don't think that's the most appropriate conversation, but I'm also going to report that to the charge nurse because verbal abuse is a form of mistreatment and it must be reported to the charge nurse to protect the resident and address the behavior. 96. If a resident has long hair, which procedure cannot be done by the nurse aide? A, shampooing. B, daily brushing and combing. C, braiding or styling the hair. Or D, cutting the hair to remove tangles. What can you not do as a CNA? You are correct. You are not going to be doing D. You cannot cut anyone's hair to remove the tangles. Nurse aides are not allowed to cut a resident's hair. This is a task that requires a professional license to ensure that it is done safely and appropriately. So maybe your facility has some type of detangling solutions, etc., but you cannot cut the knot out of a patient's hair. Question 97. Forgetting to raise the side rails as ordered causes a resident to fall or be injured. This could be called A, an accidental fall. It could not be helped. B, neglect to keep the resident safe. C, unreported incident. Or D, safety standard. You forgot to raise the side rails and your patient fell. It is neglect. It is B. Forgetting to raise the side rails as ordered is considered neglect. You failed to ensure the resident's safety and well-being. 98. We're almost to 100. During post-mortem care, the CNA notices jewelry. Oh, we already answered this one. So sorry, this was a duplicate. I owe you one more question. All right, question 99. A pressure sore that involves intact skin with no blanchable redness is classified as, is it stage 1, 2, 3, or 4? Intact skin with redness. What stage pressure sore would that be? Waiting for a few more responses and revealing the answer in 3, 2, and stage 1 is just redness, you all. So a stage 1 pressure sore. So the answer is A. Stage 4 pressure sores present as intact skin with non-blenchable redness, often over a bony prominence, an area where bone is protruding. This skin may feel warmer or cooler compared to surrounding tissue. All right, and so question 100. A resident with severe anxiety becomes visibly upset and starts pacing in their room. What is the best action by the CNA? A, offer them a distraction such as watching TV. B, ask them to stop pacing as it could disturb others. C, stay with the resident and offer to talk with them. D, leave the room and allow them space to calm down. What do you think, team? All right, and we'll be revealing the answer in 5, 4, 3, 2, and if they're visibly upset, You can do C, offer to stay with them and talk with them. Remember, communication, as far as healthcare providers are concerned, is that patient doing more of the talking and we're doing most of the listening. So, staying with the resident and providing support can help them feel safe and reduce their anxiety by addressing their emotional needs. And now we do have a bonus question, you all. And the bonus question is, did you find this video helpful? Oh, that's so awesome. All right. So, I will answer those two questions, but yes, it was very helpful. Would be A. B, somewhat helpful, but I have more questions. C, not really. I need more detailed explanations. Or D, this video did not meet my needs at all. So if it's D, I'm not sure why you're here, but I hope it's not D. So hopefully we get some A's, we get some B's, we get some C's, and on the next screen, you get to tell me what you want. So, call to action. That's right. I listen to you. Let me know your thoughts. Your feedback helps us to improve and create more content that is tailored to your needs. And as I said before, don't forget to like, subscribe, and share more information. I think someone asked, do we teach in North Carolina? Our questions are good for pretty much every state, but we do not have a physical location in North Carolina. We are in Jacksonville, Florida. Then I think I missed one other question. I'm trying to find it now. Thank you all for saying the video was very helpful. That is so great to hear. And so Elise was saying that everyone in their house has had a very good Thanksgiving. So that is a great comment also. Do you all have any video suggestions? Is there anything we haven't covered that you would like us to cover? And so don't forget that our Black Friday sale is in effect. You can get our CNA exam prep workbook for only $9.99. Just go to our website, fltraining.com, and then you'll see on the drop down, you should see a tab that says CNA exam prep workbooks. And so, for two, we do have a CNA class online, but it does not result in certification. It's for those who need exam prep, but it can be taken for by anybody, anywhere. If you need additional assistance, it has practice questions, it has review materials, it has documents. So it is pretty thorough, and the cost is $29 per month. All right, so Ray Ann, when you go to our website, fltraining.com, you'll be able to see our class schedules. We do have in-house classes for, of course, December. We do not have our January schedule up yet. All right, so Nikisha wants more videos on vital signs. And if you all don't have any more video suggestions for me, Barad, you know how much I appreciate you, and I appreciate you all. So I am going to be signing off. Have a wonderful Thanksgiving, safe travels, everybody. And I will see you all again probably on Saturday because we do have our Kahoot available, and I will be sending out that information shortly. So if you haven't gone to our website, haven't subscribed, haven't gotten a freebie, that means I don't have your email address. But if I do have your email address, I'll be sending you the code so that you can sign to the Kahoot. But you can also check our community tab on tomorrow. So everybody, good night. I love you. Safe travels. And again, happy Thanksgiving. I'll see you in the next video.